All right, so now it's time to talk about a little bit manual therapy. And a lot of people are under the stress right now, and they don't even know they're under the stress. They come in just in the office and say, how are you? How you doing? I'm fine. Just my hip is a little bit in pain. So and I see how they breathe. And most of the time, people they slouch forward, and what's happened to them? They kind of shrug those shoulders and they breathe that way, up. Or sometimes they don't even breathe. And what I'm doing here, what we're doing in our class, we try to teach that breath 360 when you try to extend your ribs, your belly, and that's a great anti-stress exercise because your breath always, it's the biggest tool, it's the greatest tool, and it's always help. So every time people come in, they stress, they tense up, they can't relax. And to work on that person, massage him, it's not going to be beneficial. He might feel a little bit relief, but what's going to happen to him later, he might feel sore because he tense up and you might use a little bit too much pressure. A lot of massage therapists or therapists like to use the pressure, or a trainer try to stretch more through the force and create that pain later. And it's happened a lot of times. So what I'm doing here to relax my client, I always do a little breath work with him. David, go ahead, come over here. So sit down. I usually do this against the wall. We already showed this exercise. But what I'm doing as a therapist, I make him sit down. The clients come in. I'm usually stay this way, but in the camera purpose, I want you to guys show what I'm doing. So I find that solar plexus, that right, it's a xiphoid process. It's that middle of the rib, and go a little bit down. And my other hands, it's in the back. So I want him to feel his breath. Exactly. Here we go. And if you not put this arm, the lower back is slow down, slow down. You see, he's trying to go push through this process. I want him to go slow. I want to calm him down. When he's exhale, I'm squeezing a little bit. So he get this push against my arm. And I want him to breathe. Here we go. Do you feel that lower back start working? Mm-hmm. Before it wasn't move. Now it's moving. Slow, come down. I want him to chest is not rise. I want his belly pushed to the forward. Now come up a little bit more up. I push this down. You see, I push down. And my other hand's behind on that chest area in the back. Let me get this TikTok people so they can see more. Yes, TikTok people. See what I'm doing? Arm is up here. He's breathing. Extend your chest. I'm trying to, if I don't feel that push, he can't push it. What I'm doing, I'm apply a little bit more. Here we go. Now you feel that? Mm-hmm. And I do feel which side is breathing better. So, and I know, I'm going to ask him, which one you feel breathing more? Mm-hmm. Take your time. Which
the
stronger?
Left, the left?
Yes, the left is pushing more harder. You can feel this active, and this is the plan. So breathe. So you see he's extended his ribs. And I calm him down. You can go back to the belly again, to the lower back. Next one, it's a side muscle. I want that ribs is pumped like a heart. So I'm get this on the side. Extend. Yes, I usually stand right in front of him. So he's pushing against that rib. He's activated. Good. There we go. Look, in first two breaths, the right one wasn't turned. It wasn't pushing against me. Now, when I'm squeezing more, his brain start reactivate. And guess what? Now he gets stronger because he reactivate all this diaphragm muscle, the belly muscle. It's going to help to support his core because he's going to be sitting. How you feel?
It feels good.
And he more relaxed.
Yeah.
More relaxed. More relaxed, yes. Next one, I want to show you guys this nice thoracic mobility for our clients. I like to do this exercise before he's going to lay down. So I ask him to get this arm, cross it together, fingers like this, put right behind your head. The elbow is coming forward. And usually I do both sides, but today I'm just going to show you one side. This arm, you're going to just place that right in here on your arm. So place that elbow. The other arm is coming on thoracic area. And what I'm doing here, I'm just move him a little bit forward. And this arm is pushing close, not on the spine. The TikTok people probably seeing it right now. I push on the side, not on the spine. We never push on the spine. I'm doing this left side now because if I'm doing right side, I have to lean and I can injure myself. I don't want to injure. How you feel?
It feels good.
Always communicate. Here we go. You feel that pop? I'm not pushing too hard. I see this therapist, massage therapist, they crank to this position, to this first barrier, and they apply the force. This is adjustment, especially for massage therapists. You're not supposed to do that, but always gently pay attention. Also, you can do rotation. The person, go ahead, hug yourself. All I'm doing, like I said, I'm supposed to stay on that side, but for the camera purpose, I'm standing on this side. You can come in, and it's called tango, like, you know, the people dancing. So your ear come to his ear, like this. I'm not turning my head towards him. My head is close. I don't want to just microphone. And what you do, you start twisting. You see this arm? This leg is support that knee, so he's not moving. And I'm doing this tango. And and when I get to this first barrier, I don't want him to collapse. Some people start to change. I want him to be straight. Look, I'm just holding myself, this arm.
It's tight.
Yeah, this guy is looking better. So I'm adjust him, and what he's doing now, he resists me, push against me. Yeah, so what he's doing, he reactivate all those small muscles around the spine. So it's like this. Push against me. And yes, and if you go relax, and if you go more, you can you can truly adjust him, but I'm not recommending him. Yeah, I know.
The muscles are tight.
Exactly. And we got so many muscles on your spine. They go like across, like that, what's the call? The pine tree. If you take that leaf from the pine tree, you see those patterns. And the same with our spine. Because our spine get this micro movements between the spine, because between those vertebrae, it's called that multifidi and rotaries, right? Rotaries, multifidi. Yeah, it's English. Yeah, we got some accent. So, but this is how they call, and it's important to work on those muscles. Okay, so this was how I start my session. You can also do this on the table. The person lay down on the table. You can play with that springing system of the rib. Try to calm the person down. If person come in like this and you start doing those stretches or exercise, it's not going to be beneficial. You can do damage. So that's the key. And we'll see you guys next time. See you later.